Good afternoon, everyone. Welcome. I'm just going to give everyone a few moments to get situated, and we will start our session in just a few moments. Thank you so much for taking the time out of your afternoon to be with us. I'm hopeful that I'm a familiar face. My name is Melissa McVie. I'm the Director of Communications with the Ontario Association of Residents' Councils, known commonly by our acronym OARC. And we're so pleased to be partnering today once again with the Ministry of Long-Term Care to provide a spring update for residents. Joining me today from the OARC team is resident leader Gail Ramsden, who will be assisting during the question and answer portion of the webinar and bringing some resident feedback forward. Gail is president of the Resident Council at Pearly Health in Ottawa. She serves as a director on OARC's board, and she is the co-chair of OARC's provincial resident advisory group called the Real Group. Thank you, Gail, for being with us as part of our esteemed panel.
Thanks, Melissa.
And thank you, Gail. And as you heard moments ago when you signed in for the webinar, you heard it announced that we are in fact recording today's webinar. That is a popular question that we usually get. Will there be access to the recording? And the answer is yes. We will look forward to sharing the recording as well as the accompanying slide deck in French and English on OARC's website. We will also circulate that to anyone who registered for the session. So you can look forward to seeing those later in the week. And the updates we hear today are likely to generate lots of great questions and discussion. So we will invite you to utilize the question and answer feature on your toolbar so you can pose your questions, and the most appropriate presenter from our panel will endeavor to respond to you. We will also have opportunity if you would like to raise a virtual hand. If technology is on our side, we will do our best to unmute you so you can share some feedback or pose a question in live in real time. And alternatively, our ministry partners will be sharing an email address on one of the slides. So if there's feedback that you have following the session, that feedback is also welcomed. So lots of opportunities to engage with our presenters. So without further ado, it's my sincere pleasure to introduce our first guest from the Ministry of Long-Term Care. Welcome to Laurie Coleman. Laurie is the Director of the Long-Term Care Response in the Long-Term Care Policy Branch. Thank you so much for being with us, Laurie, and welcome.
Thanks, Melissa. A big hats off and a thanks to our partners at OARC. They're the ones who do such a fantastic job connecting us with residents right across the province. We so greatly value these opportunities to connect directly with residents. So a big thank you to you all for taking time to join us today, and to OARC, and in particular to Gail. It's been a pleasure to meet Gail. It's nice to have you here. Again, my name's Laurie Coleman. I work in the policy division at the Ministry of Long-Term Care. And just before we get underway with today's presentation, I did want to take a moment to acknowledge that I'm speaking to all of you today from my hometown, which is Burlington, Ontario. Maybe some of you are in Burlington as well. And Burlington is in the traditional territories of the Anishinaabe, the Haudenosaunee, and the Wendat peoples. Burlington is located in the area that's covered by Treaty 3 3/4, which was signed between the Crown and the Mississauga peoples. Some of you may already know this, but that treaty is also known as the Brant Tract because it was purchased by the Crown from the Mississaugas for the Mohawk chief Joseph Brant for his military service to the British. I know we have people participating today from right across the province, and It's also nice in Burlington where I am today. The sun is shining. It's a beautiful day. It is a little bit windy out there, but as the spring is blooming and we start to see renewal of all the nature around us, I hope that everyone that's able to join us today can find some quiet moments to really reflect on where you live, what your relationship is with the land, and what it has been throughout your entire life, and how we can work collectively to really advance our commitment to truth and reconciliation and to ongoing engagement with Indigenous heritage and communities. We'll move to the next slide because I'm really happy today. I'm joined by a number of colleagues from across the Ministry of Long-Term Care. And we're here today to share information on a number of different topics. And that includes the spring 2024 COVID-19 vaccine campaign, respiratory illness guidance, funding changes, and other ministry updates. I'll be coming back in as well because there's been some changes to the rules in long-term care, and I want to provide an update on those. So my thanks again for taking the time to join today's information session. And I'll pass it on to my colleague now, Christine.
Thank you, Lori, and good afternoon, everyone. I'm Christine Loureiro. I'm a director in the Operations Division at the Ministry of Long-Term Care, and I'm pleased to be here from cloudy Pickering to give you an update on some of the changes to the COVID and respiratory guidance, as well as about the spring vaccine, and also to spend some time getting your thoughts and feedback on what we can do for planning for the next respiratory season. I do want to start off just by giving you all a sincere thank you for all of your efforts and sacrifices and doing your part over the course of what has been a pretty challenging respiratory illness season over this past fall and winter. Maintaining that balance between ensuring health and safety while also ensuring overall well-being is really important to the ministry. And hearing from you directly really helps the ministry in being informed about our next steps. So I am looking forward to hearing your thoughts in a few moments when we get to that slide. So if you can move me to the next slide, please. We'll start with the spring COVID vaccine campaign. As you know, it's absolutely critical to stay up to date with your vaccines in order to remain as protected as possible against severe illness due to respiratory infections such as COVID-19 or the flu. Because of waning immunity with the vaccines over a period of time, and also that COVID isn't yet determined to be seasonal in the same way that the flu is, there has been a recommendation that individuals who are at higher risk of severe illness, that they get another COVID vaccine this spring. And that includes for people living in long-term care homes. Next slide, please. In Ontario, the spring COVID vaccine will run from April to June, and it's targeting the following individuals that you see listed on this slide. And that includes any adult over the age of 65, adults living in long-term care homes and retirement homes, as well as individuals who are immunocompromised. Next slide, please. Receiving a COVID vaccine this spring is in particular important for those who did not receive their vaccine in the fall, but is also being recommended for those who did receive their vaccine in the fall, again, to ensure that added protection year round from COVID-19, because COVID does continue to circulate year round. You're eligible for your COVID vaccine. You can receive it 6 months after your last vaccine, but you can also receive it as short as 3 months after your last vaccine with advice and guidance from your healthcare provider. So speaking to your home around the right interval that will be administered in your home is the best approach there. Next slide, please. I will say we do anticipate there will likely be another fall COVID vaccine campaign as well in advance of the next respiratory illness season, as well as the annual flu vaccine and the RSV vaccine, which was just newly rolled out last year. More details about the fall campaigns will be provided a bit closer to fall. And there is a link here for additional information online if you're looking for any additional information on the COVID vaccine program or speak to your healthcare provider. Next slide, please. I also wanted to provide some updates on the ministry's COVID guidance. So homes continue to be required to follow the Infection Prevention and Control, or IPAC, as we like to acronym it, the IPAC requirements set out in our Act, in our regulations, and in the IPAC standard for long-term care homes. That includes, wearing a mask based on a risk for staff, based on a risk assessment, regularly screening residents for any signs or symptoms of infection, practicing hand hygiene, conducting IPAC audits. And some of the changes and what we built into that IPAC standard were done based on what we learned through the pandemic. And with these changes to enhance the IPAC programs in long-term care homes, the ministry has made the decision to revoke the COVID-specific guidance documents, as all those best practices and requirements are now embedded in our regulation and in our IPAC standard. So really, this is a change that streamlines and integrates a number of our IPAC and outbreak management related documents while still maintaining really robust foundational IPAC requirements in long-term care homes. So we wanted to make sure you were aware of those changes. Next slide, please. Homes must also continue working with their local public health unit when in outbreak. So those kind of guidelines are really set out in a Ministry of Health guidance document to support homes and the local public health unit on managing outbreaks based on the specific circumstances of that unique outbreak. Ministry of Health has also made some changes to their guidance, and I have my colleague Stephanie here from the Ministry of Health who will just go over some key highlights related to that change. So if we can move to the next slide, and Stephanie, if I can call on you to get that.
Sure.
Update.
Hi, everyone. Thank you for having me today. I'm happy to be here. My name is Stephanie Georgopoulos. I'm a Senior Policy and Programs Advisor with the Infectious Diseases team in the Office of the Chief Medical Officer of Health. Super mouthful here at the Ministry of Health. And so what our team does is we really participate in anything related to infectious diseases. We lead the programming for public health units and revise policies and things of that nature. So my team was the one who created this outbreak guidance document. And obviously over the pandemic, healthcare and the health system has evolved. So we do have we wanted to kind of move with the evolution. And so we have some updates to our guidance that is currently being practiced. These aren't necessarily new things, but what we did was we had 3 separate documents before. One was for COVID, one was for other respiratory diseases, and the other was for gastroenteritis and related diseases they're called enterics, but they're related to your gut. So what we did was we amalgamated all those 3 documents into one, and we updated some of the direction. And what we did was we developed this guidance document for public health units to be able to manage outbreaks with the long-term care homes. And so I just wanted to point out some things that we have updated in terms of yourselves, the residents. So we wanted to refocus the direction in our guidance document to highlight the importance of the balance between resident mental health, caregiver support, and infection prevention and control. We saw over the pandemic there were many challenges with masking and some of the other items where caregivers facilities were in outbreak, and there were some challenges with caregivers being able to visit and things like that. So we wanted to make sure that we captured all of those things in this document to ensure that there was some balance there. And what can you do to stay healthy? So I know Christine had already mentioned it, but it is something we mentioned in our guidance document as well, which is that you can ensure that you stay up to date with your vaccinations to prevent getting sick or having any serious outcomes. You can ensure that you clean your hands with alcohol-based hand rub or soap and warm water if your hands are visibly soiled. And you should be doing this before eating, after going to the bathroom, after touching doorknobs and handrails, and before and after touching your face. Sometimes we forget and we touch things and then touch our face, and this is oftentimes how people become ill. And then following requirements in your homes regarding IPAC practices. So the use of different PPE, hand hygiene, which is the hand washing. And so we kind of just put all this information into our new document. And although it is a very technical document that is for public health units, we wanted to make sure that there was a focus on the support for residents. Thank you very much.
Thanks, Steph. I really appreciate you going through those updates and as well as joining us for the webinar. There may be some questions around outbreak management or feedback, so really great to have you with us. So thank you.
Thank you.
So that brings me to this slide where we're already, so, we're just coming out of the respiratory illness season, but already thinking about next year and wanting to plan for, as in advance as possible, how we support long-term care homes and residents and staff and family members through the next respiratory illness season. We work really closely with the Ministry of Health and staff and her team to get a good sense of what projections might look like to inform, but also hearing from you, hearing from your family members, hearing from homes helps inform some of the actions we can take. So if you can move me to the next slide, please, that'd be great. We really want to spend a few moments with you to hear any feedback you might have for us today. If you do have further feedback, we welcome any feedback by email or through OARC at any time. This isn't the only opportunity for you to be able to share your feedback. I will say before we open it up for discussion that this past respiratory illness season was quite a challenging one. It was one where we saw the cumulative impact of COVID, flu, and RSV peaking around similar times. We had more COVID outbreaks this year than we had last year. It was over 1,000 over the course of the respiratory illness season, but we did see fewer residents get infected with COVID-19 during those outbreaks, and we saw lower severity of illness. So due in part to the IPAC practices and to vaccine uptake and all of those good things that you do to keep yourself healthy and your co-residents healthy. So I just wanted to start with that. And really what we'd like to hear from you is, what do you think supports you the best, and what has worked well from your perspective? What could we as a ministry and what could your homes do differently to support a healthy and safe next respiratory illness season? So with that, I don't know, Melissa, if you'll help us facilitate, and I think I might be turning it to Gail, but I'll leave it to you to help facilitate, Melissa.
Thanks so much, Christine. And yes, Gail, I think had some feedback to share. And then I'm encouraged, I see some hands going up, and we will call on our audience next. So over to you, Gail.
Yeah, thank you very much. Yeah, I've got some feedback which has been collected over the last little while, mostly from input from residents, their observations and comments. So in terms of what worked well, I think that there's been a concerted effort on behalf of the ministry to try to keep residents informed and advised in advance of changes, upcoming updates and that sort of thing. And I think that that's really been a step in the right direction. And residents want to know what's going on. They want to know what the changes are ahead of time. They don't want to be told after the fact that this is being done to you. So there's an appreciation for knowing in advance from the residents' perspective. The tone, I think, is also more resident focused, and that's in line with the direction that we're all trying to work towards in the industry with resident-centered care. The focus has, we've also observed the focus on consultation with the residents' councils as an additional way of keeping the residents informed of what's coming down from the ministry. So in terms of what could be done better, some of the comments that I'm hearing is first and foremost, I think, is the fact of homes layering on their enhanced IPAC desires on top of the guidance from the ministry. It is confusing to residents as to how that happens. And it also creates an environment where residents in one home are treated differently than residents in another home. And I'll give you the example of, in some homes, when there's an outbreak declared, the 1 or 2 people that are positive are the ones that are being kept on the unit. In other homes, when 1 or 2 people on a unit have been declared positive and there's an outbreak determination, the entire unit is locked down. And I don't think I need to tell you what that kind of thing can do to residents who are still healing from the pandemic traumatizing effects of being locked down week over week over week. So homes layering on is the first thing. There was also a lot of confusion, at least in my home, and I'm assuming in other homes as well, of the masking rules, where masks were required on the unit, but not in residents' rooms. And as soon as I went off the unit, not for me, but as soon as my guests or my caregiver went off the actual unit into common areas of the home, the mask was no longer required. So there was confusion about that. I could sit and have a coffee with visitors without masks on, but as soon as they walked down the hallway in my unit to get to my room, they had to put a mask on. So that was 2 of the big things. I think the only other one is the idea of, when are we going to be learning to live with COVID? And I saw an indication on the slide that we just saw about the 24-25 season and the kinds of things that the ministry is going to be looking at. And I think that's the question coming from residents. Like, at what point are we going to acknowledge that COVID is not going anywhere and we have to learn to live with it without going through this ceaseless repetition of guidance coming out every 6 months on what we're doing this time. We all know that we have flu season. We all know that there's flu and RSV and COVID viruses, and you know, what are we going to do about it? How are we going to get back to normal? So I think those are the main highlights of what I had in my notes. Thank you very much.
Thank you so much, Gail. I don't know, Melissa, I know they're just cognizant of time. I could probably spend half an hour chatting with you about these. I just really appreciate hearing from you directly, and you've probably got some input from some of your friends and co-residents. So really appreciate that. And I've taken note of all of that. The one comment I do want to say is, I think what we were doing collectively before COVID wasn't enough. I think what landed us into the situation that we were in with COVID in the initial stages is because we didn't have all the robust practices in place. We've all collectively have really moved in the right direction around better IPAC practices. And now we're trying to find that right calibration of the right safety precautions. I think what you heard today is we're moving away from just the COVID specific guidance and really it being part of how we look at how we're managing respiratory illnesses, other infectious illnesses. So it's really around embedding that into the regular practices and learning to live with COVID, to use your words. So all really excellent points you've raised. So thank you, Gail. Over to you, Melissa.
Thank you. I'm hopeful to call on Ann Donaldson, who's raised a virtual hand. I'm going to click on something that should allow you to unmute yourself. And if you're able to,
Yep.
Oh, perfect. Oh, it's great to hear from you, Ann.
Nice to hear from you too.
What would you like to share?
My question is, well, it's a comment question, whatever. The one slide that was dealing with risk assessment and masking, what my understanding is from the IPAC here is that masks are no longer required. It's a sort of each to their own. If you want to wear a mask, you wear a mask. If you don't, you don't. But what is exactly, I don't see anywhere in any of these slides where there's an actual rule that is supposed to be followed. What is the ruling when it comes to masking?
Yeah, thank you for the opportunity to clarify that, Anne. Excellent question. So there's no requirement for residents to wear a mask. That's been in place for some time. It's up to personal choice and based on their ability to mask. For your caregivers, family members, visitors that come visit you, there's no requirement for them to wear a mask. Again, it's a personal choice. For staff, there is a requirement that they wear a mask, what we call based on a point of care risk assessment. And what that means is an individual assessment of the interaction between the healthcare provider or the staff person and the resident based on the circumstances. So as an example, if I'm the staff person and I'm coming to visit you, Anne, and I see today you have the sniffles, I will apply my judgment and wear a mask when I'm providing care to you, or maybe I'm kind of feeling like extra tired today. I'm not sure what it is. I'm not really sick, but I'm feeling extra tired. I'm going to just wear a mask as a precaution in some of my interactions to ensure that there's no transmission. If I did happen to be sick. So it's kind of now based on the point of care risk assessment for masking, and that's kind of like a routine practice that was in place even pre-pandemic in terms of how a healthcare provider, when they're providing care, should be assessing the situation. So there's no additional masking requirements beyond that, with the exception if your home is an outbreak. So if your home is an outbreak, there is definitely enhanced masking that will happen to help reduce transmission in the home.
And does that happen, the enhanced masking, does that happen for the unit alone or for the entire building?
That would really depend on the circumstances of the outbreak. So the home would be working with their public health unit to assess the circumstances of that outbreak and see how widespread the outbreak might be and what the right measures and precautions might be related to that, which would include masking.
But definitely the unit where there is 1 or 2 or 3 or however many people, that the unit itself, everybody working there should be wearing a mask.
Yeah, staff coming into that space where there's residents who are being isolated would be wearing masks. I don't know, Steph, if there was anything else you wanted to add from an outbreak management guidance perspective.
Hi, Christine. I think that you've covered it really well. I think sometimes it's really difficult to explain all of the scenarios that could potentially be a scenario you would need to mask in, especially if it's a circumstance for residents and when they would need to mask. Infection control practices are a bit complicated. So for me to answer your question in a way that makes sense, if people are, let's say their hands aren't clean and then they're putting on their mask or they're touching other things, those things can be contaminated and you can go down a rabbit hole of like, did I touch this? Am I sanitizing my hands? Am I washing them? The best thing that I can say is that when there are times of the year when, you know, let's say for respiratory season, autumn season comes in and there's an uptick in respiratory cases, and we see it going really, really high. In those times, sometimes there will be direction to mask more often, especially if you're not feeling well, or you know, if the staff person is doing their point of care risk assessment in those moments, there will be different direction. In general, I think the idea is that if the risk is not really there, that we would encourage not masking, right? Because you want to be able to not have to wear a mask all the time, but you
Sure.
also want to wear it at the moments where it's really important to do so.
Yep.
And you will get direction if there are specific moments where you're being given direction and you feel like, you know, this doesn't really feel right, or I have questions about this. You can always reach out as a member of the public, even to your local public health unit, and they can give you more information as well. They're really helpful with all of that stuff, and that's who we wrote our document for. And they're always up to date on the most current practices. So I would encourage you to maybe reach out to them, even reaching out to long-term care, the Ministry of Long-Term Care. They obviously have all the information as well. So if there's times where you're confused about it, not that this is really helpful because it's not a straight answer, you know, and that's the mixed up part, is that there are times where you'll need to, and there are times where you may not really need to.
No, I don't need, sorry, I don't need a mixed up. I understand it's all mixed up. I just wondered what the ruling was, and I think you've answered the ruling. The ruling is you don't have to wear one if you don't want to, period. And all the other things are sort of subtitles within it. So thank you very much. I appreciate it.
Thanks, Anne. Maybe with that, I don't think there's any other hands up. So just huge thank you to Gail and Anne for your feedback. As I said, there are other opportunities if you want to share your feedback with us post-session. And maybe with that, I'll turn it over to Suja to go over the next set of slides. Thank you very much, everyone.
Hi, everyone. Hopefully everyone can hear and see me. My name is Suja Sundarlingam, and I'm a manager with the Funding and Programs branch of the Ministry of Long-Term Care. And today I'm just going to highlight some key operating funding investments that we made this year. It'll be relatively quick. So with that, we can go to the next slide. So the first funding we wanted to highlight is the increase to the level of care funding. So the level of care funding is the primary operating funding that's provided to long-term care homes. And this year, the government is providing a 6.6% increase, or $353.1 million more in operating funding, which is actually the highest operating funding increase in recent history. And this increase includes an 8% increase in the funding for resident food. With this funding, homes will hopefully be able to continue to provide nursing and personal care services, programs, and activities, housekeeping, laundry, and meals for residents at the current rate. Next slide, please. So the second funding investment that we wanted to highlight is the one-time funding that was provided to homes in the early part of this calendar year, of approximately $202 million. And this funding was intended to help homes improve the quality and safety of accommodations for residents. And homes can use this funding to address outstanding code compliance pieces or maintenance improvements, such as changes to furniture and equipment. So those are really the two key funding investments we wanted to highlight for you guys. And if there's any questions, happy to take it. No? Okay. Then I can pass it back.
Sorry.
Oh, sorry.
Sorry, Suja. The one-time funding, what is that? How do you apply for that, and how much is it? What is there a do you have to qualify?
No, so the one-time funding was provided to homes, and it was provided to all eligible homes with long-term care beds, and it was provided to address certain key priorities in the sector, such as sprinklers, deferred maintenance, and any other eligible expenses. So homes can use it really to address any outstanding pieces that we highlighted, or for any other costs that the home may have, as long as it's an eligible cost.
So it's already done?
Yes, it's already done. It was provided it was provided as part of the last fiscal year. So it was provided, approvals were provided in March.
Okay, and the other piece I wanted to question you about is the food budget, the funding for the food.
Mm-hmm.
Has that gone, I understood it was going up specifically, but I didn't hear that in terms of what you went over.
Of course. So the level of care funding includes several envelopes, and one of them is for nutrition. And for this year, there was an 8% increase to that envelope, and that would be effective for this. So we operate on a fiscal year, but it would have been effective as of May.
And what does 8% equal out to?
1 second. I have to pull out my old.
I believe it's a $1 increase, taking us just over $13. I don't want to speak out of turn, but
1207 to 1307, does that sound right?
Probably. 1 second. Sorry, I do have the numbers. I just want to make sure I'm giving you the right numbers. Okay. While I'm looking for that, was there any other questions with regards to those two? No.
there was a question about, I guess, the most of the funding announcements maybe don't include, or they're not specific to homes that have the LDCAP designation. Is there a specific stream or way that they can access some of the funds that you've mentioned?
So LCAP beds are funded under the global budget for hospitals, and as such are part of the Ministry of Health's budget. So this doesn't apply to LCAP beds, and they're both of these investments do not account for LCAP beds.
So perhaps if someone is maybe tuning in today from the LDCAP, from an LDCAP home, they could connect with the ministry directly to with any specific questions or support needs.
I'm sorry, it is correct. It is a $1 increase in the nutrition envelope.
Thanks for clarifying.
Great. Thank you very much for the clarification.
No problem.
And thank you, Tiffany, for that question about LCAPs. We will be sharing an email for any follow-up questions on a later slide. So perhaps there could be a continuing of that conversation about funding for LCAPs. Thank you. I believe we also have a virtual hand up from Andrea. I'm going to queue you up to speak with us, Andrea.
Yeah, thank you. I have a question about the funding for long-term care homes that serve specialized food like kosher food, which is much more expensive. Is there a way or that we can apply for increased funding, because to purchase kosher food and prepare it is much more expensive than food that is not kosher?
So currently, sorry, video back on. Currently, we don't have any program that provides additional funding outside of the existing nutritional support. There is an allocation provided per bed per day for nutritional support. So we can take that question back and see if homes have raised that issues to us, and if there's been ways that we've addressed that. But currently, we don't have any special programs to apply for any additional fund beyond that.
Is there somebody that we can reach out to, or can you reach out to me afterwards so we can be connected?
Yes, you can email us at LTC Homes and info at LTC Homes, and additionally, we can also receive your information.
Sorry, info at LTC Homes.
Sorry. info@LC, I can't speak. Info, all right. Hello?
I
Yeah,
believe it's going to be on.
Info, you can provide it at info@ltch.homes.net.
.net. Okay.
Yes.
Yeah, okay, thank you.
And thank you for your question, Andrea. And just the email address will be presented on a slide and
Ah,
at the end of our presentation, just in case we captured it down wrong. So we're happy to share that, and it will be circulated with the recording. So thank you for that. I think there was one other question for you, Suja, about where can our participants tuning in today, where can they access, where can the public access the figures for funding? So I think that's the level of care funding that you've just reviewed.
So that has been posted for homes on ltc.net, but it's also been made available on the funding, the general ministry website as well, which again, we provided the links at the end.
Okay. Great, thank you. Thank you for that. If you have any issues finding that or navigating the website, again, you can reach out with us. And I'm sure we'll also be showcasing some of those level of care numbers through our OARC communications as well, so that residents and their supportive partners can know some of those infusions of funds.
Mhm.
So I think that concludes the questions that have come through so far. So I'm going to invite Lori to share.
Thanks, Melissa. And in follow-up to one of those questions, I wanted to add again, we will have our contact email on the last slide of this presentation. I think what you might find is that we've got multiple emails at the Ministry of Long-Term Care. So Sue just provided one there. We've got a slightly different one on the last slide. But if you email any of those, you will get a response. We'll make sure that it gets to the right place that can provide the right answer. And really do invite you to send any follow-up questions that you have into us. So we'll move gears now. I wanted to share some information about some changes that we've had recently to the rules for long-term care homes, and to talk about what those rules might mean for residents. We've created an information sheet that's designed for residents that explains what these rules are. We'll make sure, if you haven't already gotten a copy of that, that you get a copy of that after today's presentation. We can move to the next slide. Actually, no, we'll pause on this one. Sorry about that, Bethany. So these new rules were approved on April 26th, so not long ago. And they're new rules that homes have to follow. And they're really centered in 4 different areas. So there are some changes to the qualification requirements for some of the staffing positions in long-term care. There were some changes to pandemic provisions. Also, some technical updates to both air conditioning and replacement homes. And I'll talk about those all a little bit, and then we'll pause in the end to see if there's any questions. So we can move to the next slide. Before I talk about those 4 different areas, I did want to just address, some of you might wonder why we've changed the rules. It's not that long ago that we introduced an entirely new act, and we made changes to the rules about a year ago. So I wanted to explain that the ministry, the changes that it makes really are in line with a commitment to ensuring that residents are receiving the best care and quality of life. And so for us, that means that sometimes we need to make small changes to the rules as the environment changes, as our circumstances change. And we really want to be continuously improving. And so the feedback that we get, and we get feedback quite regularly from residents in forums like today, we also, we get emails, we post materials onto websites to get feedback. And we look at it very closely from residents, from families, from caregivers, from people who are important to residents in long-term care, as well as homes. So staff working in homes, leadership in homes, and we take all of that input and consider the rules for long-term care. We work very closely with OARC, who helps us to connect with residents like we are today. So we'll move to the next slide, please. The first group of rules that I wanted to talk about are related to staffing qualifications. So we've heard regularly from homes, from residents and families that we needed to find more ways to make sure that homes have the staffing teams necessary to support residents in their homes. And so we've taken a close look at those rules and the rules that might make it hard for a home to retain staff. And we made some changes that supports more flexibility for homes to hire and retain qualified candidates. So there are some rules, including these, that have already taken effect. So they took effect on May 1st. And on May 1st, one of the key changes is that homes will have continued flexibility until next July. So July 1st of 2025, to hire a person for personal support services, as long as they have the skills, training, and knowledge to perform the tasks of a personal support worker. So that flexibility is in place for homes. It's been in place for a number of years now, and it will continue to be in place for just over another year. We can move to the next slide, please. Some of the other changes in the area of staffing are sort of rules that guide which staff in a home can perform certain things. So right now in homes, only nurses are allowed, or were allowed, to do skin assessments for residents. But sometimes there are other health practitioners, someone like a dietitian, who might be best positioned to support a skin assessment for a resident. So as of May 1st, regulated and registered health professionals from other health professions, so not just nurses, but any health profession where they have in their rules for their profession, they're allowed to perform a function, they'll be able to perform skin assessments. So that's an important change for us, because we've heard from a number of areas that there were limitations within the regulation that meant that health practitioners couldn't do all of the things that they would be able to do in other settings. We also made a change to ensure that the nursing students, many of you will have nursing students who are working in your homes, who meet the requirements, are able to perform similar functions, provided that they are overseen by a registered nurse. We can move to the next slide. There's a few other changes to staffing qualifications and flexibility, but some of them don't come into effect until July 1st. So as of July 1st, we talked a little bit about nursing students, but nursing student externs who are working in homes will be able to administer drugs, and again, as long as they're working under the supervision of a nurse. And that really allows nursing students to continue to learn. It's helping to build out our health human resources workforce. Again, they're overseen by a member of the registered nursing staff and the homes, who really determine whether or not they have the skills, knowledge, and experience to perform that function. A last piece in this space is, and out of interest, is that registered practical nurses will be able to complete one of the assessments that's used to determine eligibility in long-term care. And that change is going to allow and enable better support for resident care, because registered practical nurses will be able to work again within their full scope of practice, and that should free up time for registered nurses to focus on higher level clinical tasks. We'll move to the next slide. And the next slide is really considering pieces related to pandemic recovery and stabilization. So similar to some of the thoughts that we heard earlier from Stephanie and Christine, we're experiencing fewer COVID-19 outbreaks in homes. And in line with that, the ministry has removed some of the pandemic rules, or will be removing them as of July 1st. And those changes are including ensuring that eligibility assessments for community applicants, so someone who's looking to come into long-term care from the community, are completed with the most up-to-date information about that person. It also will be changing that the pandemic we won't be able to have the pandemic as a reason for discharge from a home. So those are some of the rules that are shifting with regards to pandemic recovery and stabilization. Also on the next slide, the changes in the rules about exceptions that give homes flexibility for 24-hour nursing, the Director of Nursing and Personal Care, and staff orientation requirements. Lastly, and maybe most relevant, is that the changes ensure that residents will continue to have access to visitors during emergencies. So not just during a pandemic, it's broadened it out to emergencies. And we'll move to the next slide. We had some changes to the rules that are much more technical in nature. So with respect to air conditioning, there are extensive rules around air conditioning, and we had lots of questions from homes over the past couple of years, and who were seeking clarification about the rules for air conditioning. So with summer fast approaching, as of May 1st, residents will have more choice for air conditioning preferences. So the changes clarify when homes would not be required to install a portable or a window air conditioning unit if it's been requested by residents. The next change relates to making clear about that when room temperatures are over 26 degrees Celsius, so when it's really hot and a room doesn't have air conditioning, the rule is that the remainder of the day and the following day, homes must implement a heat-related illness and management plan. Now we're moving into the last suite of changes here. And then we're going to get to questions. I think we've got a few that are coming in. So there were some clarifying changes to the rules that will come into play as of July 1st. And they relate to when residents are being transferred from their existing home to a replacement, a related, or a reopened home. It's going to allow homes to support faster and more streamlined admission requirements. Currently, only homes that are operated by the same entity or licensee are we able to streamline that movement. So with the changes, it should be an improvement for residents who may be in homes where there are those changes to designation. So we'll move to the next slide. We do want to continue to connect. I think we're hoping that message is coming through loud and clear today. I'm sure we'll be continuing to take a look at the rules that guide us in long-term care. So if you have input for us, we're more than happy to hear that. I'm going to pause there because I'm mindful of our time. I think we've got some hands up. And I don't know if I'll have to catch up on my chat here. Melissa, maybe I'll rely on you if there are ones that are jumping out.
Sure. We had a question, I think, that was going to be directed to Suja on the panel.
Perfect.
About level of care funding. Is this permanent?
Yes, Yes, sorry. Yes, the level of care funding increase is a permanent increase.
Thank you. That was straightforward. Now we had Jim had a hand up that I think has maybe gone down. So perhaps Jim, your question was answered. If you would like to ask something, please feel free to raise your virtual hand once again. And then we've got a live question from Andrea. So Andrea, I'll just give you an opportunity to pose your question.
Yes, I'm just wondering if there's anything you can talk about the unforeseen consequences of Bill 7 and people trying to get into a long-term care of their choice. If you have any information that you can provide regarding Bill 7 and especially faith-based homes and people being where they want to be.
I'll invite any of my colleagues to jump in on a response. Andrea, I don't have really a lot of specificity around that, but what I can tell you is that last year, the Ontario's Auditor General did an audit, a value for money audit of long-term care, and the ministry received some recommendations that are right in the space of what you're talking about. So there were recommendations for the ministry to take back and consider with respect to cultural homes, to providing service for younger residents. There are recommendations that look at the transfer of alternate level of care patients from hospitals into long-term care. So it's definitely something the ministry is looking at very closely. I don't have any specific information that I can share with you, but do want you to know that it is something that we're looking at closely.
Yeah, I know that there is a court challenge in September. I read it on I forget the website that you're referring to that shares lots of information. That they've mentioned that there is a court challenge to Bill 7, but I thought maybe somebody on this panel may have some additional information.
Thanks for your question, Andrea. I think there would certainly be an opportunity to follow up on your question, and maybe someone from another branch within the ministry could get back to you. So the slide that's currently being projected has the most, I think, appropriate email address to be used. So if you could maybe follow up, we'd be happy to have someone
Thank you.
give a little bit more detail than we have time for today. Now we're going to have offer Laverne the opportunity to have the last word for our last question for our guests today. So I'm going to unmute you now, Laverne, if you'd like to share.
Yes. I just like to say, first of all, I'd like to have all the slides as I missed out trying to get into here. And second of all, I have a problem where a family support person was denied to come in early in the morning because he's a family member, but he is needed for the person he takes care of to help that person get out of bed. Now, does anything in your legislation provide for that situation that we can make it easier for the home?
Thanks for the question, Laverne. I've gotten a number of colleagues that are with me on the line today. I'll ask if Jade is there and in a position to answer.
Hi, thank you. So in terms of visitor policy, as part of the introduction of the Long-Term Care Act and supporting regulations, there were changes made that allowed the access to essential visitors. So we can look more into what this qualifies as, and we can, if you send an email directly to MLTC correspondence@ontario.ca, we'll respond with that to understand to provide a little bit more guidance on definition of essential visitors and if there's specificity regarding care provision. Hopefully that's helpful.
Okay, well, I'd like that. I'll be asking maybe on the your correspondence line to further explain the situation, because as it stands now, people who help others in the home are not allowed to be in the dining room or allowed to help that person before 10 o'clock in the morning.
Okay, thank you. If you could please include all those details, and just recognizing that within the act and the regulation, there are requirements that might not have such great specificity, and then long-term then interpret it and apply it within their context. So some of these issues might be related to the long-term care home policies and their interpretation and application of the regulations. I just want to provide that context, but we really look forward to receiving your email and providing as much information as we can that's specified in the regulation.
Thank you.
Thank you very much.
Yes, thank you. Thank you for the question. And it's hard to believe how quickly an hour can go by. So certainly on behalf of all of my colleagues here at the ministry today, Melissa, thank you so much for getting us connected with residents. Gail, I very much appreciate your participation as well, and particularly the questions that have come from people that have joined us today. So thank you, everybody. Melissa, I'll pass it back to you.
You took the words right out of my mouth, Lori. Just a reciprocal thank you to you and our panel of ministry guests, and to Gail for helping to really infuse some resident feedback. And it's always so special to have the real-time engagement. And I'm hoping that today's conversation will spur on some conversations at the long-term care home level. Certainly the level of care funding increases that we heard about. I'm sure there'll be lots of buzz and questions around how is that money going to be used. Hopefully you'll be able to bring this back for further conversation through the resident council and through ongoing conversations with your home leadership. And we will certainly be sharing today's presentation, the slides, the recording, and some of the handouts that Lori mentioned, kind of what's changing in terms of the regulations and what residents may expect. So there'll be lots of resources so you can continue that conversation. And thank you again for spending the last hour with us. Have a lovely rest of your day. Thanks, everyone.